For just about any pediatric health condition, we find there are gradients in how the children do, and almost inevitably, for every condition, lower income families are doing worse health-wise than higher income families.
One of the things we've come to understand is that health outcomes in Cincinnati vary considerably neighborhood to neighborhood. And we know that some kids who live in neighborhoods with high rates of poverty or high rates of substandard housing often bear the disproportionate burden of health outcomes that we really strive to prevent.
We at Children's can uncover those issues. We see those families. They trust us. We can learn what the legal needs are, but we're not a legal organization. So we need to look to the legal experts at Legal Aid, to our partner that we have through HeLP, to help us address those needs so that we are meeting the holistic needs of the family.
I'll have a family that comes in and maybe they've been struggling with mold in the house for years. Their expectation is that there's going to be nothing that I could do. So then when I talk about HeLP, that this partnership we have, lawyers and legal advocates actually here in the clinic today who can meet with you, and they could actually help you get to a solution. The families just sort of light up.
When you think about the hospital helping you with other concerns, I guess you feel like, what can they do, really to help me? And like I said, I was shocked how much help was actually extended to me. She helped me get my gas and electric back on because I didn't know how I was going to even feed them. When I got in touch with her, I was actually homeless. I had nobody to call, nowhere else to turn. So it was a relief that I had somebody, I feel like, in my corner that was able to help us.
To be able to say, I have a legal team that is literally in room X across the hall is fantastic.
Being on site adds urgency and humanity to the work that I do.
It's not just another referral that they're getting from the doctor or from a provider. It's an actual human contact.
Not only get results for them, but also work on the systems that have created those problems for the family.
So a medical legal partnership shares the same vision, it can share the same outcomes, and it has sort of co-designed processes so that for a family, they might actually think we're all employed by the same organization, that if we can work so effectively together and so seamlessly, it could feel to them, and we want it to feel to them, that going to speak to a legal advocate is as easy or even easier than getting in to see the pulmonologist.
Our referrals from Cincinnati Children's are related to housing, public benefits, and a family having enough food to eat, education, special education, school disciplinary removals, and a child's health and mental health in school, and family law issues including domestic violence.
Healthcare providers at our 3 primary care clinics refer between 700 and 800 families a year for HeLP. And those 800 or so referrals translate to thousands of children and adults helped in the referred households.
It's not just serving clients one-on-one. It's also looking at what are systemic issues that the client population faces that we can address in a broader way that maybe affects not just the clients that we serve at Legal Aid, not just the patient families that the PPC clinic serves, that Hopple Street and Fairfield serves, but also can have a positive impact on other people in the community.
So often we know our health outcome information, our health outcome data, and our legal partners know the lay of the land with respect to housing across our community. When we've begun to overlay these factors and to think about health outcomes in association with housing, we've seen those patterns and been able to act more at a system level. Our legal partners are then far more adept than we would ever be at forming tenant associations and beginning to advocate not just patient to patient, but say complex to complex or neighborhood to neighborhood.
Cincinnati Children's has set a whole new standard nationally for what it means to integrate lawyers into the healthcare team. They've done it deliberately and strategically and consistently, and so that means that the lawyers are on site and working directly with the healthcare team members. They're participating in training the next generation, and that's pivotal for the kind of growth and change that we're going to see nationally.
Historically, medical education did not include social determinants and issues on poverty and the effects that they have on health, growth, and well-being of children. So we were really at the forefront.
We've been doing this for 10 years. We've trained hundreds and hundreds of doctors about the social determinants of health, and now they're all over, and I feel really good about that.
Child Help would not have been so successful if not from the very beginning we prioritized making it one team.
By being able to combine the expertise, the experience, the training, and the passion of physicians and attorneys, we're able to collectively achieve so much more for our families than either of us doing it independently.
I've had a number of families, a number of parents where I've seen tears in their eyes of somebody actually wanting to help, trying to help. And that's been incredibly powerful to me.
Now that I see like the benefit and the amazing things we've been able to do, I think like I could not practice without having, you know, a legal team here with us.
I am gratified to have the opportunity to improve the lives and well-being and outcomes for children and families that we serve through Child Help by working jointly with Cincinnati Children's.
Not only can doctors and lawyers work together, but they can really work hand in glove with the same vision in mind for what families hope to achieve.
Everything just seemed like it's looking up, now.